Hi, I'm Diane Miessler. I'm an RN with Nevada County Senior Outreach Nurse Program, and I'm going to be talking about medications and fall risk. At the end of this, if you'd like a copy of the talk, I'll give you my phone number, so grab a pen. It's important to follow your doctor's orders and to take your medicines regularly. It's also important, though, to be educated about your medications and talk to your doctor about any concerns you have. In this talk, I'll use doctor to refer to any provider who writes prescriptions. Certain types of medications can increase your fall risk. I think of these as the 3 Bs, medicines that affect your brain, your blood pressure, or your blood sugar. I'll talk about brain medications first. These might be taken for sleep, for depression, for anxiety, for psychosis, or sometimes for behavior problems found with dementia. Many of them can cause balance problems, lightheadedness, or a drop in your blood pressure when you stand up, which can lead to fainting. One type of brain medication is given for insomnia. Some common ones are Ambien, the generic for that is Zolpidem, Sonata or Zaleplon, and Lunesta or Izopiclone. You'll notice all of these have a Z in their generic name, which is a giveaway that they're that type of sleep medication. Besides unsteadiness, these sleep medicines can cause memory issues, especially in people over 60. If you're noticing balance problems, lightheadedness, or memory issues, you should review your medications with your prescriber or pharmacist. A second type of brain medicines I call the antis, antidepressants, anticonvulsants, and antipsychotics. The last two might be prescribed for depression and also for behavioral problems in people with dementia, which unfortunately is a group at higher risk for falls. So be sure you know what you're taking your medication for and know the side effects. And a third type of brain medication is the benzodiazepines, which are used to treat anxiety and sometimes to help with sleep. I call these the PAMs because the generic names all end with PAM or M. Common ones are Ativan or lorazepam, Xanax or alprazolam, Klonopin or clonazepam, Valium or diazepam, and Restoril or temazepam. Benzodiazepines are one of the most common medications associated with fall risk, especially in elderly. But it's very important to know that you should never stop benzodiazepines without medical supervision. It's true of all medications, but benzodiazepines are especially risky because stopping them abruptly can cause increased anxiety and even seizures. So, brain medications are the first B. The second B stands for blood pressure. Sometimes medications for blood pressure can work too well and drop the blood pressure dangerously low. This can be because of interactions with other medications, dehydration or weight loss or lifestyle changes. And as we age, our ability to correct our blood pressure when we stand up decreases, which can also lead to fainting. For that reason, it's believed that the target blood pressure for older adults should be higher. A conservative figure is about 140/80, which might be higher than you thought you were shooting for. If you have a blood pressure cuff at home, it's good to check your blood pressure sitting and also about a minute after you stand up and see how much it drops. And a side note on blood pressure is that medications given for enlarged prostate can also drop your blood pressure. A common one is tamsulosin or Flomax. The third B medications are used to treat high blood sugar in diabetics. Like blood pressure medicines, these can work too well, and low blood sugar can cause confusion, dizziness, falls, and even coma and death. Problems with blood sugar medications usually happen when people exercise more or eat less than usual, or with new medications. It's really important that blood sugar medications have food to work on, or they can drop your blood sugar too much. If you're being treated for diabetes, don't skip meals. Take an extra snack if you're exercising more than usual. And if you ever just feel off, check your blood sugar. That can be really helpful information for your provider. Write down the time and what was happening at the time. In general, it's a good idea to periodically review your medications with your doctor or pharmacist, especially if there are changes in your medication regimen. A pharmacist can check for drug interactions, another factor that can lead to increased fall risk. And a good rule of thumb is if you find that you're feeling dizzy or faint, or especially if you fall, get in touch with your provider to see what you can do to lower your fall risk. So to review, the 3 medications associated with falls are medicines that affect your brain, your blood pressure, and your blood sugar. If you have any questions after this talk, write them down and get in touch with your doctor. And it may be that your provider decides that the benefits of your medication outweigh the risks, but it's an important conversation to have. And educating yourself about side effects of your medications can help you avoid or prepare for them. My phone number, if you would like to leave me an email to send a copy of this talk, is 530-205-5824. You can also find a link to this talk on the Hospital Foundation's YouTube page. And my phone number again is 530-205-5824. Thank you for listening, and remember, knowledge is power.